Assalamu alaikum.
Done, honey. Can I ask someone else?
All of you can hear me? So today, the topic of to be taught to you today is the epidemic keratoconjunctivitis. Okay. I hope you all can hear me clearly. Hello? Ji, can you hear me now? Okay, the topic of that is to be taught today is epidemic keratoconjunctivitis. Now, what is epidemic keratoconjunctivitis? Basically, it's a type of viral infection that infects the conjunctiva of a normal person. This virus is named as adenovirus, and there are many serotypes of this adenovirus. Okay? The serotypes that are associated with the conjunctivitis are the 8, serotype 8, serotype 19, and serotype 37. Very less frequently, there are other serotypes which can also cause the adenoviral keratoconjunctivitis, EKC, and they are in front of your screen. But basically, if there is any MCQ in front of you and they ask about the serotype, you have to write 8, 19, and 37. These are the three main types of the serotypes of the adenovirus that causes the EKC. Okay. Hello, can you all hear me? Hello. There is actually, how does this disease is transmitted? Adenoviral conjunctivitis is more prevalent after, especially after the rainy season, and the mode of transmission is direct contact. There are air droplets and possibly swimming pools also that can also lead to transmission of the EKC. Hello. Now, what happens that the transmission of this disease is basically through the fomites, or sometimes there is a misconception about the transmission of the epidemic keratoconjunctivitis. And what is that misconception? People mostly think that when you see an infected eye, by looking onto the eye, you can get the infection. This is a wrong concept. It can occur because of just watching onto the eye of the other. It can occur through the airborne droplets. Okay, so but it can also occur through the fomites, but it can't occur by just looking at the eye of an infected person. So this concept is absolutely wrong. EKC was basically more common. It has been more common in this part of the world, that is the Asia. In European countries, EKC is not that much common, and luckily this disease is a self-limiting disorder, and it is spontaneously, it resolves itself within 1 to 3 weeks without leaving any complication. Many people get it in their life, at least once in a life. Everyone get the red eye, which in Urdu we call it Ashobichasham. You must have heard about this name, Ashobichasham. This occurs in many people, especially after the rainy season. And then if one person in a family gets this infection, most of the time the whole family members get involved, and this can cause infection in all the family members because it's a very much contagious disease. And before the red eye, or it is preceded by some fatigability and malaise, the non-specific symptom that can occur due to any viral disease. Okay, sometimes there is vomiting, diarrhea, or myalgia also. So these are the non-specific symptoms of any viral disorder, but the specific is the red eye, the discharge from the eye. There is a little bit pain, and then the patient feels, uncomfortable. And then the incubation period of this disorder is 2 to 14 days. That is, once a person has conjunctivitis, the other can get it within 2 to 14 days. And a person remains infectious for this disease to others for 10 to 14 days. And the incubation period is different. The infectious period is different. Incubation period means that it is the time period from which one person is in contact with an infectious person, and then he starts developing the symptoms. This is the incubation period. While infectious period means that an infected person can transmit this disease for this much period of time, that is 10 to 14 days. Okay? The symptoms are basically a little bit, uncomfortable discomfort in the eye. There is not a severe pain. No, there is never severe pain. There is some photophobia, foreign body sensation, excessive tearing, redness of the eyes, and sometimes they can get a little bit pain around the eye, not in the eye, but around the eye. And mostly this disease goes away within 3 weeks. The patient becomes normal. Okay, and sometimes the other eye, one eye is involved, and then after some period of time, the other eye also gets infected. Sometimes both of the eyes get infected at the same time. So it's not necessary that you can say that this is a bilateral and symmetrical disease. This might be the unilateral, or it may be asymmetrical. Along with the redness of the eyes, watering, a little bit photophobia, the patient might have a preauricular lymphadenopathy. Now, this is not a symptom, this is a sign. You have to examine the preauricular lymph node just in front of the ear. When you will feel them, you will find that there is pain over there. There is a little bit enlarged lymph nodes around, just in front of the ear. Okay. Mostly there is no decrease in visual acuity, but sometimes if the cornea is involved, then there might be a decrease in vision. Otherwise, there is just swelling and erythema of the lid. There is redness of the conjunctiva, that is hyperemia. There is swelling of the conjunctiva, that is chemosis. There might be some follicular reaction in the lower palpebral conjunctiva. There might be papillary reaction. There might be subconjunctival and petechial hemorrhage, which is rare. But these people who get EKC, they have a combined follicular papillary reaction. Why this is important? Why am I emphasizing on to the follicular and papillary reaction? Because these are the conjunctival responses to any inflammatory agent. Okay, in case of viral diseases, the patient will have a combined follicular reaction as well as papillary reaction. In other diseases, the patient might be having pure follicular reaction. While in still other diseases, the patient might be having only papillary reaction. Okay, how does the cornea is involved? mostly the cornea is not involved, but sometimes the cornea can get involved in EKC. And what are the different types of corneal infection that can occur due to the adenoviral keratoconjunctivitis? One is the punctate epithelial keratitis. Punctate epithelial keratitis is small dots of inflammation that can occur onto the surface of the cornea that occurs for 2 to 3 weeks. Okay, these punctate epithelial keratitis lesions, when you will stain them, they will not be stained with the fluorescent dye. That is the typical step, diagnostic point of this disorder, PEK, punctate epithelial keratitis. When you will stain them, they will not be stained. Then there might be focal epithelial keratitis, central ulceration, along with grayish white dots and that persists for 1 to 2 weeks. Sometimes there is subepithelial infiltrates. There are some epithelial infiltrates. There are focal lesions that can occur into the stroma, superficial stroma, and then resolve slowly and gradually. Okay. What is the treatment? You have to give them cold compresses. You have to give these patients artificial tears. And in our community, in our part of the world, we have to use the steroids, especially along with antibiotics, because you want to suppress the secondary infection in the steroids, just because you want to suppress the inflammation. So you have to use the steroids in this type of disease. Okay, so this was something about the, what we call the uh, epidemic keratoconjunctivitis. There is one more topic that I want to teach you today. Hello. Hello. Can you all hear me? Hello.
Yes, sir.
Is there any question regarding the topic of epidemic keratoconjunctivitis? Hello.
No, sir.
Okay. The next topic was, can you see it on your screen? Ocular surface disease.
Yes, sir. Yes, sir.
ocular surface disease. This is a very important topic, and basically these disorders are very common in our community because here the atmosphere in which we live is a temperate and it's not a moderate climate, it's a temperate. Our region is a temperate region, and over here especially the hot weather is too much common, and that's why the diseases which are more common in hot areas, they are the ocular surface disorders, because our tear film which prevent the eye from get dried is evaporated very soon in the hot areas. So if there is any problem in the tear film, if there is any pathology in the conjunctiva, then it can lead to many ocular surface disorders. Okay, this is a picture in front of you where you can see different parts of the eye. Just for your revision, that this is which region is the pupil, then this white of the eye is the sclera, this is the iris, these are the two puncti, then these are the lacrimal canal, or you can say canaliculi, this is the nasolacrimal sac, and this is the lacrimal duct, or this is the lacrimal gland. Now these are all the parts of the tear surface area, because tears are secreted mainly from this gland. They float through the eye and then they leave through this lacrimal passage. So this is the main overview of the lacrimal system. Okay. What is the role of the eyelids in keeping the eye moist? They keep the eye protected, they regularly blink, and therefore they stabilize the tear film, they protect the eye. They are rich, the eyelids are rich in many glands which are which play a pivotal role in the different tissues and the functions of the eye. The eyelids have a rich blood supply and they don't have a venous wall. These are the different parts of the eyelids that are being shown over here. Okay. Now, corneal epithelium, conjunctival epithelium, tear film. These are different, surfaces in the eye, because the cornea is covered by a superficial epithelium, conjunctiva is covered by a superficial epithelium, and tear film is the one which is a liquid layer which covers the whole cornea and the conjunctiva. Okay. Now, if you just talk about the ocular surface, what are the parts that are included in the ocular surface? Is the conjunctiva, cornea, eyelids, lacrimal gland, and the lacrimal passage. These are the different parts. And what is basically tear film? It's a liquid layer. It is most of it is contains the aqueous part, and superficially it should have a layer which prevent it from easily drying, and that is the oily layer, the lipid layer. The lipid layer is the most superficial layer, and the function of this lipid layer is that it protects the tears from getting evaporated. Okay, the main central or the thickest layer is this aqueous layer. This is the aqueous layer, water layer. The outermost is the lipid layer, and then the innermost is the mucin layer. Why mucin layer? Mucin is adherent part of the tear film. It is sticky, and it gets sticking to the eye, to the conjunctiva and cornea, so that the tear film stays over there, hangs over there. So these are the three parts of the tear film. Okay, what are the function of the tear film? It cleanses the eye, it wets the eye, it has a bacteriostasis property. Okay. What is bacteriostasis? Have you heard about bacteriostatic and bactericidal? These are the two different antibiotic properties. Bactericidal system means that those medicines which kill the bacteria. It's bactericidal, and bacterio is the other is one is bactericidal, the other is bacteriostatic. Bacteriostatic basically do not kill the bacteria but freeze them, inactivates them. Do not kill but inactivates them. Here, this term is a little bit different. It's bacteriostasis, means many bacteria can come and live in this tear film. Okay? They can live in this tear film and they stay in here. That's why we call the term bacteriostasis. Okay? All the bacteria are not bad for the body. Some of the bacteria are useful also. And therefore, another function is that these tear film allow the oxygen to cross it and supply it to the body. Okay? Now these epithelia, the conjunctival epithelium and the corneal epithelium, they are derived from the stem cells. The stem cells, where are they present? They are present near the limbus, the corneal limbus over here, the limbus. At this limbus, the stem cells are present, and they will generate the corneal epithelium as well as the conjunctival epithelium. Okay, the conjunctival epithelium is a little bit derived from this, but most of it is derived from the fornices and the palpebral region. Okay, some of it comes out from the limbus, but most of the corneal epithelium comes from the stem cells in the limbus, while the stem cells that are present in the fornix and the palpebral region, they give rise to conjunctival epithelium. Okay. Now let's start with the ocular surface diseases. Basically, it's a complex of the disorders that occur due to the problem anywhere in eyelid, conjunctiva, lacrimal apparatus, or tear film. Okay, what are the corneal and conjunctival lesions? For example, uh, they have further subdivided into squamous type and the limbal stem cell deficiency type. What are the tear film disorders that causes the ocular surface disease? The aqueous tear deficiency, the lipid tear deficiency, the mucoprotein deficiency, and the kinetic disorders of the lacrimal fluid. Okay, how do you treat these disorders? You have to do the reconstruction. The limbal stem cells, they are the basically very much important for the intact corneal epithelium as well as conjunctival epithelium. So you have to either graft stem cells over the limbus. Okay. What is the difference between a healthy tear film and a dry eye? See, healthy tear film is like this. It's a very thick layer covered out on the outermost portion by the this is the lipid layer, this is the aqueous layer, this is the mucin layer. So in a dry eye, the aqueous lipid layer is broken, you can see, and the aqueous layer is evaporated from here, and it is deficient over here. You can see even the mucin layer is not working properly now. Okay. So dry eye is also called keratoconjunctivitis. SICA, it's a chronic lack of sufficient lubrication and moisture in the eye. Okay. Its consequences range from subtle and to ocular inflammation of the eye. Basically, keep a basic concept in your mind that dry eye is basically deficiency of tear film in the eye. But in the single line, if you just describe it, it's a deficiency of the tear film in the eye, which makes the eye dry. Okay, and then this dry eye becomes exposed to different bacteria, viruses, and fungi, and they can cause infection. Okay, tear film, from where it is secreted, most of it is secreted from the lacrimal gland, which is actually the aqueous part of the tear film. Then there is meibomian gland in the conjunctiva, which produces the lipid part of the tear film, and then there are the goblet cells of the conjunctiva, which produces the mucin part of the tear film. The three parts of the tear film are secreted by different parts of the eye. Okay. There might be aqueous deficiency, aqueous tear deficiency, there might be lipid deficiency, there might be mucus deficiency, and then there are kinetic disorders of the lacrimal gland. What are the general symptoms of a dry eye? Whenever a person is having dry eye, he will have main symptom will be foreign body sensation, grittiness, and dryness in the eye. There might be burning in the eye, light sensitivity, pink eye. Okay. And then what are the diseases? Basically, there are autoimmune diseases mostly that are responsible for a dry eye. We will discuss them one by one in the upcoming lectures. Okay. How do you diagnose a dry eye? You have to do a Schirmer test. You have to do a tear film breakup time. You have to stain, and then these basically three diagnostic tests give you a main diagnosis of dry eye. Okay, this is a generalized cutaneous disorder, skin disorder that can lead to dry eye. And I've told you that there are many autoimmune disorders that can lead to dry eye, like rheumatoid arthritis, sarcoidosis. Okay, and then there are Steven Johnson syndrome, many disorders that can lead to dry eye. Okay. Uh, okay. And if a patient is having dry eye, you have to give a tear film replacement therapy in the form of drops, maintain the moisture in the eye, increase the tear film secretion. Immune have to be inhibited because autoimmunity leads to the dry eye. You have to re-establish the tear film. Okay, you have to whenever there is meibomian gland dysfunction, they will lead to a deficiency of mucin secretion, and this will lead to again a dry eye. Okay, the meibomian gland dysfunction occurs just because of meibominitis or closure of the opening of the meibomian glands. That leads to the deficiency of the meibominitis and then the mucin secretion in the tear film. For the treatment, what you have to do, you have to massage the tear, the eyelid margin, because tear film opens because the meibomian glands open at the eyelid margins. And so you have to massage the tear film, okay? The eyelid margin. You can use some antibiotics.